Felloways, support through sight loss. Donna Parker from Healthier Lancashire and Cumbria discusses the organisation's survey for people who access ophthalmology services.
I just wanted to really share with yourselves and patients who use ophthalmology services just about some of the work that we're doing across Lancashire and South Cumbria. With regards to ophthalmology and the rising demand for ophthalmology services with an ageing population, we've come together as a group of commissioners across Lancashire and South Cumbria to look at how we can improve ophthalmology pathways consistently across the patch. We've come together to look at prioritising cataract, glaucoma and wet AMD services, creating a set of standards, outcomes and measures that are the same across Lancashire and South Cumbria. So we first engaged with clinicians, so they were consultants from across all acute trusts across Lancashire and South Cumbria, to identify the three areas and what it was that we needed to support and underpin some of that work around the standards, outcomes and measures. So things very clinical for the care pathways. And then the second element of that was to liaise with service users, or how we're sort of trying to integrate with some of those services. And it was about really speaking to yourselves and people with visual impairment who access services. And we do have a survey, hoping that we can sort of share that survey with the service users that are on today and other people, so that we can really drive and improve patient outcomes. And that's the second part that is really, really important to us, because we need to understand what is really important to service users. So if there is something within the survey that you would like to tell us about what is important to you, then we need to capture all of that information to improve our care pathways and to make sure that there are outcomes there. Just to give you a bit of an idea, so from a clinical perspective, what we were saying is that, you know, any patients that have been referred to AMD pathways, glaucoma pathways, sight-threatening pathways, that all of those patients should and will be signposted to an ECLAW at the first appointment, so that they're able to get that additional support for non-medical social intervention and emotional support that visual impairment might require. So in some areas we know that we have got ECLAWs, and in some areas we haven't, but it's making sure that we sort of join those things up. So it was really just to tell you about the piece of work that we're currently working on, and how you can hopefully help support the information that we receive from patients to complete the survey.